Okay, so good morning, everyone, and thanks for joining our webinar today. The title of our webinar today is Work Disability Management System Standard for Paramedic Service Organizations, Managing Disabilities Associated with Operational Stress Injuries. We're very pleased to host this webinar. This is webinar number 3 out of the 4 webinars that will be managed by the Canadian Institute for Safety, Wellness, Performance and the Center for Research on Work Disability Policy. And the purpose of these webinar series is to increase awareness about a newly published Canadian standard for work disability management system for paramedics. Today, we present ideas and perspectives on addressing OSI, operational stress injuries, in the context of work disability management. We start with the opening remarks by Pierre. We talk about standard development process. We provide you with some understanding of the state of knowledge when it comes to operational stress injuries among paramedics. And following that, we'll have a quick panel discussion on issues and perspectives when it comes to operational stress injuries and prevention and management of disabilities related to those injuries. Our speakers today are myself. I'm the Executive Director of the Canadian Institute for Safety, Wellness, Performance, and Dr. Emil Tampa, the Director of Center for Research on Work Disability Policy. Our panelists today are Dr. Kathy Campar from Center for Addiction and Mental Health, Kathleen Fraser from Alberta Health Services, and Dave Libby, Cancer Renfrew Paramedic Services. Let's open it up with Pierre Pyre, the Chief Paramedics, Chief of the Ottawa Paramedic Services, and the co-chair of the Standard Development Committee for this standard. Pierre.
Thank you, Min, and happy to be here today. It's always kind of a good news to see us getting the message out. And I think that's an important piece of the work that you're doing with Emil. This standard really is something that's complementary to a few other standards that have been developed over the last several years. Of particular note is the standard for psychological health and wellness that was developed about, I say 3, 4, 5 years ago. And this builds upon that. There's also a fatigue risk management standard that's being developed. And this one in particular is an important one in terms of the recognition of what we can do better. And sometimes I use the word I here, what I can do better to support staff within the Ottawa Paramedic Service. So I'm really kind of interested in today's discussion. There's an incredible amount of work that's gone into the development of this document. And I think it's important for the paramedic profession of particular note that as we mature as a profession, that the development of standards, not unlike what the fire community has done with the National Fire Protection Association, the NFPA, that the paramedic community is developing a suite of standards to really help guide and improve the service to not just our staff, but to our communities. So thank you very much, Amin, for the opportunity to speak today. Great work by you and the team, and I'll turn it back to you. Thank you.
Thank you, Pierre, for the introduction. And as always, we appreciate all your supports for all these research initiatives and research and development initiatives. I would like to acknowledge the funders. This research and development project was made possible in part by the financial support of the Canadian Safety and Security Program managed through the Defence Research and Development Canada Centre for Security Science. And the views expressed in this standard do not necessarily reflect those of the funding agency, and would like to kind of also acknowledge the support from the Canadian Standard Association, as well as Paramedic Association of Canada and County of Renfrew for their support throughout this project. I would like to now hand over to Ron Myers from CSA to walk us through CSA's standard development process This will be a brief overview of the process involved in development of this standard. Pierre? Sorry, Ron.
Yeah, thank you. And welcome everyone. Thank you for joining us today. I'm going to be very brief. I just wanted to talk a little bit about CSA. I'm a project manager. I've been working for CSA for over 25 years now as a project manager developing national standards of Canada. I was not involved with this project. My coworker, Lena Lopez, who was the project manager, is away had to be away today. So I'm just kind of filling in, but a little bit about, who we are and really about, every time I have an opportunity to speak, I always talk about, promoting CSA standards and how to become involved. You've probably heard of CSA. We're the largest standards development organization in Canada. We develop standards, but there's really two parts to CSA's business: standards development, which we're going to talk about today, and supporting education, products, implementation tools. Amin had mentioned that. And we're also into research that will help in the development of standards. And that's an increasing side of our business as well. And we're doing more research work. On the other side of our business, in terms of our testing, certification and testing business, we have offices all over the world where we test products to many different types of products and services. And that's our kind of our commercial type of the business. So there's our standards development and our certification and testing. I'm going to talk a little bit about our standards development. We're a fairly large organization in terms of the number and types of standards that we develop, and we follow a very rigorous accredited standards development process. And you can see on the screen all the different types of steps that we go through in terms of developing a national standard. And the important thing, and really my job as a project manager, is to recruit subject matter experts to participate on a technical committee, such as this technical committee that developed this standard. So we're always trying to promote, engage people to get involved with CSA standards development. And you can see through the process here, from committee development, they work very, very hard, through the consensus process, which is not always easy, through many, many meetings in terms of drafting the standard, which then, as a key step, is then sending that draft out for public review. So at some point during the process here, this particular standard was sent for a 60-day public review in accordance to our policy directives. And the committee would have then reviewed all the public comments that had come in and continued working to finalize the draft and reach consensus and go through our rigorous approval process in terms of through a ballot process to formally approve the standard, go through all these internal procedures to make sure that we followed all our rules through our accredited process, and through final editing, publication, and dissemination of the standard. The standard is now published, and what we're doing now is that we're working to promote the standard, make people aware of the standard. So one of the things that important that we always try to preach and inform people is how to get involved, with standards development, how to participate on a committee, because we're always looking for people that are dedicated, have the experience, have the expertise to participate. And again, I mentioned public review. If you can't participate on a committee, there's always opportunities to review drafts and provide your comment, because it is a requirement for all comments to be addressed by the technical committee. Research is really important as well. And Pierre mentioned all the other work, some of the work that we've been doing, and I've been very, very fortunate to work with Pierre and a number of folks within the paramedic world around the development of standards. And we're talking today about Z1011.1, Work Disability Management in the Paramedic Service Organization. But over the course of a number of years, we've continued to work on other standards for the paramedic sector and first responder sector. And you can just see here some listed here. Canadian Paramedic Information System. You want to back up there for a second, Amin? And then mention the First Responder Fatigue Risk Management System that just recently was published. We're working towards a national occupational standard for paramedics that will be due out next year. Sorry, next, Amin. And just a number of other standards that I won't go through every one, but you could see that we've been really busy and we've been really fortunate to work with the paramedic sector and first responders in developing these national standards of Canada. And yeah, and that work continues. So I'm in next. So I think it's important, anybody that's participated on a CSA technical committee, it's all about, you know, making sure that we have an effective committee. No one group can dominate. And it's a requirement that we have these different interest groups. So we have, for example, on this committee, you know, general interest, and we have consultants and researchers, and we have, you know, folks that represent regulatory authorities, government interests, organizational interests. Those are our management types. You know, within a paramedic sector, management, user interests, yeah, you're making me go fast, aren't you, Amin? But so having that balanced approach and working to develop standards through consensus is really the key point. That, you know, it's our key objective in developing a standard. Okay, sorry, next. So why do we adopt standards, or why do organizations? Because it's that multi-stakeholder volunteer participation using a consensus-based approach, right? You know, it's people working together from across the country, right? Technical experts meeting and trying to agree on the requirements of the standard. And that's why a lot of our standards are adopted into legislation, are used, and you know, it's a less expensive approach. What's really important is all standards are living documents. They have to be reviewed at least every 5 years, where decisions are made by the technical committee to reaffirm the standard if everything's good, or often, you know, there's a requirement to update the standard. There's a lot is learned over the course of 5 years, and a new edition of the standard may be needed and published. And the technical committee will continue to meet and develop that new edition as appropriate. And we're always looking at what's happening internationally as well. You know, we don't want to reinvent the wheel when things are, you know, when there's things that we can take and we can learn from. So that's really it in a nutshell. We look forward to trying to recruit new people to participate in our CSA committees.
Thank you so much, Ron, and apologies for the glitch. And yes, you kind of
yeah, I had to, that was a speed talk there.
Yeah, that was good.
That's okay though.
All right, thank you so much, Ron.
All right, thanks, Amin.
You're welcome. So we thought to kind of give you some understanding of what it took us to develop this standard and provide some updates as in terms of the research in this area, to kind of provide some context as what kind of researchers kind of do in this process, and what fit into the development of this standard. For those that may not be from paramedic community on the call, you kind of perhaps know that paramedics provide out of hospital emergency medical care, but their role have expanded to community paramedicine as well. And inherent to the work is tending to medical calls, and some of the calls can be exciting and manageable, while others can be frustrating, non-urgent, or even psychologically traumatic. So there are other characteristics of the work that is often involve, physically demanding tasks, economic issues, long hours, shift work, and being on the call. And overall, the work is considered to be kind of high stress with little job autonomy. And there are a lot of occupational stressors to the job, but that the job can also be very fulfilling. And unfortunately, paramedics are a high-risk occupational group for a range of mental health problems, including both clinically and non-clinically diagnosable condition that may interfere with their daily function. To make sure that we are all on the same page, and to make sure that we have this definition of sorry, I think someone has questions, Ron? Sorry. Okay. The operational stress injuries are a broad range of conditions that include diagnosable mental health disorders such as anxiety disorders, depressive disorders, and PTSD, as well as non-clinical conditions that may interfere with daily function. So, in the standard, we're using OSI as an umbrella term for all kind of mental health related outcomes. Some of the other aspect of the paramedic work that I think is important to consider is that the fact that the paramedics work in a VUCA environment that is in high in volatility, uncertainty, complexity, and ambiguity. And since the onset of pandemic, it's been said that the paramedics seem to be dealing with even more great level of VUCA, and that's kind of something that we acknowledge as well. So the funding agency provide us with funding to go through a process of research development process, looking into conducting research to inform the development of the standard, and then following that knowledge translation activities and knowledge dissemination, which these webinar series are part of it. The research was conducted by the Canadian Institute for Safety, Wellness, Performance and Center for Research on Work Disability Policy in close collaboration with our partners. To kind of give you some broad understanding of the prevalence of the issues within the paramedic groups, I kind of prepared this slide, and you can see on this table on the left side you have the Canadian paramedic survey data, and the right side you have the ambulance personnel data from that worldwide population. And then looking at these numbers, you realize that there are two or threefold differences in the number of injuries suggested by the Canadian paramedics compared to that general population. I just want to point out that among Canadian paramedics, there is an alarming 49% who is screened positive for at least one operational stress injuries. And again, with the pandemic, it's being perceived that this number is going to increase. These OSIs and these injuries not only impact the paramedics, but also the communities and the work capacity and the organization's ability to kind of provide responsive and quality paramedic care. So these values should not be compared between the studies due to different studying methods, but we can look at the trends within these studies. The fact that these kind of figures were reported by currently employed paramedics engaged in daily occupation routines and not by personnel following attendance of a specific critical incidents highlights that the importance of paramedic services implementing ongoing preventative and support measures to improve the mental health in the workforce, and instead of just only focusing on such services in the immediate period of a kind of a traumatic event. So those kind of preventive aspect of it becomes very, very, very important. We looked at the COVID-19 literature that emerged during COVID-19, and we see kind of somehow alarming numbers as you see kind of in this slide at the risk of operational stress injuries has increased over the course of the pandemic. There were kind of a few very recent studies that suggest that paramedics, about 75% of paramedics felt more anxious when treating patients diagnosed or suspect of COVID-19 pandemic. And that study was at the beginning of the pandemic. And I'm sure kind of that somehow perhaps improved or not, given that we have a high vaccination rate. But the same study in the early days of the COVID-19 pandemic suggested that 86% of paramedics reported that their anxiety level have increased. So that kind of demonstrates that in public health crisis through this pandemic, you're going to see an increased number of cases, and that's something that perhaps needs to be highlighted to paramedic service organizations. In addition to the stressors during regular operations, there are numerous stressors that comes along with responding under pandemic or public health crisis. We had a study funded by Social Science and Humanitarian Research Council, and one of our researchers, Bronson Du, led that research and found that in the literature published during public health crises, public health disease outbreaks, and more specifically SARS and other disease outbreaks, that there were several factors stand out. For instance, one of them was concerns over personal safety, concerns of safety and well-being of loved ones as a result of the work, adoption to changing job requirements, and dealing with a lack of knowledge and overwhelming amount of information, and some of that perhaps some misinformation that perhaps increase the level of anxiety among paramedics. And also making ethical decisions. And that's again highlighted in the literature as being one of the issues that may negatively impact the mental well-being of paramedics. And this research, we've published it and is available through Safety and Health at Work Journal. What we did also, we did an interview with paramedics at the start of the pandemic and during the first wave, mainly speaking about the first 6 months of the pandemic. So definitely going to be again new and unique stressors and mitigating strategies that have emerged since that. But nonetheless, this kind of interview study suggests that there are 5 emerging topics that needs to be considered. One is the overall work atmosphere and mental health outcomes of paramedics, and that's something that our interviews of paramedics suggested that paramedic service organizations focus on. Amount of information to uptake and disseminate, infection prevention and control strategies within the organization, scarce resource and triage, that's something that highlighted frequently by paramedics, and a staffing, call volume and workload that was also highlighted by them as being some of the issues that they've faced during the first 6 months of the pandemic. So what can we do to reduce the risk of and impacts of OSI? There's increasing evidence that suggests that organizational factors such as psychological safety climate, leadership style, mental health training and awareness to be significantly and independently associated with OSI. So recognition of modifiable occupational factors offers paramedic service organization the opportunity to impact the health and well-being of the paramedics by implementing organizational level strategies to manage the risk of these injuries in the workplace. The largest gain reported to be focusing on leadership training and support, improved organizational engagement, reduce stigma, and improve the sleep, as well as strengthen social support. So those kind of are some of the factors that were recommended as factors that could be implemented by organizations to strengthen their capacity to address these costly and devastating kind of situations for some of the communities. I'm going to now hand it over to Dr. Tampap to wrap up the evidence that feed into this standard. So Emil?
Okay, thanks, Amin. Next. Okay, sure. So as Amin alluded to, we've done quite a bit of research as background input into the development of this standard. In fact, there was 3 pieces of work that Amin and myself led. One of them was a literature review, which I'm going to speak to briefly here in the next slide. Another one was a needs assessment, and then an environmental scan. And those three pieces preceded the development of the standard in order to inform through best practices and understanding of the best way forward with developing the guidance in the standard. So here in this slide, I'm talking about the literature review. The objective was to identify and synthesize peer-reviewed evidence on programs and practices for the prevention and management of OSI and other mental health issues that were relevant for paramedic organizations. We looked very broadly, both at the local, national, and international literature for all first responders, because there's a lot of common ground across the first responder entities around best practices around dealing with OSI. And so the method that we used was to first identify a research question, which was what programs, practices can aid in the prevention and management of OSI and other mental health conditions in paramedic service organizations. We then conducted quite an extensive literature search and selected studies, charted the data, collated, summarized it, and consulted with relevant stakeholders to get their feedback on what we were finding in this literature. We looked at a number of databases that are listed here in the bottom of this slide. And as you can see, we also have a link for the full report here as well. And both this report and the other two on the needs assessment, environmental scan, are available on the Center for Research on Work Disability Policy website and the Canadian Institute's Safety and Wellness and Performance websites. And Amin will put them in the chat so that you can all have access to them. Okay, so the key themes that we found from the literature review was the importance of manager training in mental health and in developing their confidence, which the evidence suggests that it reduces the rates of sickness absences when managers have the appropriate training. Culture was really critical, so improving organizational culture, reducing stigma, lowering the barriers to help seeking was really, really critical. And then at the front end, particularly, was building resilience. Really important for primary prevention of OSI and mental health issues is just making sure that first responders have the capacity to deal with the stressors they're exposed to on a regular basis. Peer support was another critical aspect of the literature that we found really important to help support early detection and interventions of when mental health needs are compromised. And then finally, early and frequent contact with managers once a worker has begun an episode of absence was found to reduce the time till full return to work. So really getting that management support, regular contact to identify any kind of needs that the organization can provide through that ongoing dialogue with the manager. Two key programs that came up a lot in this literature was RESPECT and TRIM. The RESPECT is about manager training around mental health and combined with mental health knowledge and communication training, improving the manager's confidence through this program and how they deal with mental health needs of their workforce. And then the TRIM program, Trauma Risk Management Program, is a peer support trauma risk program. It requires careful selection of practitioners, strong support for the program by junior, mid-level, and senior managers for it to really be effective. Next slide. So just a very high level about the needs assessment and then the environmental scan, which are you see the covers are on this slide here. Okay, so the needs assessment, the objective of that was to determine the gaps and challenges between the current and desired conditions for addressing PTSI, OSI in paramedic service organizations. You know, we were looking to identify what paramedics needs these are from their paramedic service organizations, understand, you know, what they're currently doing, their current situation, identifying challenges in preventing and managing PTSI, and then providing recommendations. So we conducted semi-structured interviews with 11 key informants, you know, paramedics themselves, you know, supervisors, and then some union representatives as well. And what we found was that there was, I guess, 7 themes that came through from this study. You know, recognizing non-traumatic and chronic stressors are really important precursors to OSI. Building and maintaining resilience, as I mentioned earlier from our literature review, stigma reduction as well, the culture change issue, supervisory support, program, policy, and practices for managing PTSI being in place to help support workers, and then additional time for recovery, and then early and gradual return to work with modified duties was really another important factor as well. So very much supporting what we saw in the literature review. And then the environmental scan, the objective of that was to identify and synthesize existing guidelines and recommendations for addressing PTSI, OSI, and mental health in the workplace. And research Canadian agency websites for guidelines and resources pertaining to this area. And we identified 23 guidelines or resources. 6 were specific for paramedics, 10 were intended for first responders, and 7 were more general broad brushed guidance documents. And then we distilled all the materials in these guidance documents into 3 broad categories, the prevention, the primary prevention, early detection and intervention, and then disability management. And so that piece then helped also inform the development of the standard guidance we developed in the CSA document. And I'll turn it over to, is it Ron now?
So that's me now.
Oh, okay, sorry about that. Go ahead.
No worries. Thank you, Emil. That was very informative. I just want to kind of remind everyone that please use the QA function of the Zoom platform to ask your questions, and we will get to them following panelist discussion. Just kind of, again, if you've attended our previous webinars, I walk you and Dr. Tampo as well through the different elements of the standard. For today's webinar, I decided to kind of mainly only speak to briefly to some of the clauses that have specific requirements for operational stress injuries. This standard, fortunately, also covers some requirements that will help organizations to implement the disability management within the organization framework. And regardless of the type of disability, you'll be able to kind of implement that framework, and you still benefit from that as well. But again, we have specific requirements that will help specifically with the operational stress injury as well. For instance, within the context of roles and responsibilities, we have specific requirements and responsibilities for top management, for frontline managers and supervisors, for subject matter experts within the organization, for healthcare professionals, and so on, for organized labor and union representatives in paramedic community. And those roles and responsibilities, again, we have tried to provide some requirements that will help them to build capacity when it comes to operational stress injuries. When it comes to the main body of the standard, the blue items, the blue clauses are the clauses in which we have specific requirements for OSI. That being reviewing internal and external practices. We don't want organizations to reinvent the wheel. So if they do have some current practices, they will be able to kind of utilize those and then be able to improve them through some of the requirements that we've identified and we've highlighted in the standard. Establishing specific objectives and targets for OSI. This is very important. Everything starts with setting those objectives and targets and being able to have a baseline data. Then you'll be able to benchmark against current data, or for instance, if you are going to be able to implement that over a year or 2 years, you'll be able to then benchmark it towards the baseline data as well. In terms of the implementation using that PDCA model, we have requirements and some guidelines around prevention and management measures to address OSI, and that includes primary, secondary, and tertiary prevention practices. So it's not only about return to work and accommodation, but also talks about how organizations can go about primary prevention and identify those risk factors that may lead to OSI. And of course, as this is a disability management standard, we have extensive clauses and requirements when it comes to accommodation and return to work. But again, we know the sensitivity around the OSI and the stigma around it. We have some requirements to provide additional guidance for organizations to be able to implement that effectively. Last but not least, we talk about monitoring and evaluating the performance of the management system when it comes to addressing OSI in the organization. And that again considers confidentiality, considers stigma reduction activities, considers unconscious bias and all of those during all the monitoring and evaluation. One of the good things about this standard is the informative annexes, specifically for the mental health literacy training and education. This standard, I think, has done a great job on identifying some guidance around implementing an effective training and education program when it comes to mental health. I just want to kind of highlight this as well, that the standard is available in English and French, and also the fact that this might kind of again be considered as first step to really develop something that will help organizations implement a standardized, evidence-informed, consensus-based standard that will help them to address OSI and work disability in the workplace. So now, again, with that, I would say comprehensive overview of what has been done so far, and kind of a very brief overview of the OSI requirements within the standard. I'll hand it over to Ron Myers to kind of moderate the panel discussion. Thank you.
Thank you. And I just wanted to welcome, and we're really fortunate to have these panelists here that have been willing to spend their time to talk to us today. So I'm going to start with Dr. Katie Kamkar. Katie, and you can see on the screen there's questions that Katie will speak to. So I'll turn it over to you, Katie.
Thank you so very much for having me. It's always such an honor, and of course, such an incredibly important topic. So I hope that my essentially answer and response will cover very much all those questions all together. And of course, I always welcome any question and answers. We have, of course, noted that throughout COVID, the mental health needs of Canadians have been on the rise, and organizations have had to go through significant changes even to this date. And we also know that success of any organizational change is really hard to best manage everyone's anxiety. Now, going back again to this important topic of mental health disabilities, we are, of course, aware of the high cost related to mental health disabilities. We also know of the high risk of recurrence related to mental health disabilities. In other words, are 7 times more likely to reoccur than physical health disabilities. And the cost related to mental health disabilities is also higher than the cost related to physical health disabilities because of the longer duration and high risk of a recurrence. Mental health disabilities also increase the risk for not only recurrent mental health disability, but also the risk for recurrent non-mental health disability. So here we're talking about, it could be injuries, it could be illnesses, it could be any other type of sickness. So in anything that we do, it's always important to take into account a system approach, a holistic approach to care. Anxiety disorders, clinical depression, substance use disorders, as well as trauma and stressor-related disorders, and especially post-traumatic stress disorders, are increasingly being identified and addressed as part of workplace mental health prevention and interventions. We also know that anxiety and depression are the risk factors to sick leave, but also that there are consequences of sick leave as well. So in any policy, mental health implications, we need to take them into account. Both anxiety and depression are not only the most common mental health conditions, but also the most costly causes of absenteeism and disability. Now, having said that, there is also presenteeism here. The cost related to mental health presenteeism is 5 to 10 times higher than the cost related to absenteeism. So for any effective workplace mental health promotion and prevention interventions, it's essentially combining individual approaches along with environmental approaches. So in addition to any approaches that we are even talking about. Now here, the focus here, as we are increasingly addressing, is also how to enhance any self-management strategies while people are also at work to help diminish presenteeism, obviously augment work functioning, work participation, psychological well-being in the workplace, to also better manage the symptoms, because we also know if we are at work and we have difficulty managing our symptoms, we are more likely to quit, or is more likely to lead to presenteeism, absenteeism, disability, and so on. So any self-management practices that have to better manage the symptoms, optimize health, prevent relapses, and of course, boost performances. Before I talk about some key approaches from an organization and individual, and I know some of the key points were already highlighted, where we know that it's not only exposure to potentially traumatic events that are connected, related to mental health conditions, but we also know that once we control for exposure to potentially traumatic events, then we also have operational stressors and organizational stressors that are independent, significant, single contributors to mental health conditions as well, from the Carlton 2020 study. So for instance, out of all the organizational stressors, the two that are most related to mental health conditions are the perception that I need to provide value to my organization. And the other one is that, well, if I'm ill, I'm worried that my coworkers will look down on me. Out of all the operational stressors, the two with the highest mental health impact are that fatigue, and of course, the other one, difficulty establishing work-life balance. So we want to target modifiable risk factors so that we can determine, once again, coming up with approaches, with resources, we want to determine and identify the right protective factors to help buffer against those modifiable risk factors. We do know when workers face any type of, are confronted with the job strain, that they're more likely to use maladaptive coping strategies. So for instance, coping inflexibility or self-undermining, and they're less likely to use adaptive coping strategies. So setting time for recovery and proactive personality. So once again, identifying those becomes very important in terms of any preventative intervention, recovery time, because otherwise it turns into a vicious cycle of a strain and health impairment. I always like to, again, go back to the prevention continuum of care, because it is, whether it is with the physical health, mental health, it's obviously the same. So when we're talking about primary prevention, secondary prevention, tertiary prevention, they're all complementary. And we are able to, again, optimize the health and the recovery and prevention when, again, we are able to utilize strategies at both organization and worker level. So any intervention at the primary prevention is anything that we do prior to an onset of an illness. So resiliency, self-help, peer support, mental health check, anything that essentially we're talking about. Secondary prevention is, it could be an onset of a problem, symptoms could be mild to moderate, or sometimes there are no clinical symptoms, but they are significant stressors that, once again, they need to be addressed, both at the worker, and also we want to optimize organizational approaches. Then, of course, we have in tertiary prevention of care. This is here my line of work as a clinician. The goal here is to minimize symptoms, improve functioning, disability management, collaborative care model. And again, whether the person is working or not working, we're talking about work accommodation and prognosis, any restriction, temporary, permanent, and so on. In terms of any interventions, again, approaches that we want to talk about and we want to consider, we want to have, again, a system approach in mind. So having the dimensions of recovery in mind is helpful. especially the 5 dimensions of recovery. So here we have clinical recovery. So anything, again, any approaches, interventions that can help to minimize the symptoms. Then we have existential recovery, helping workers to focus on an optimistic outlook, hope, focusing on our positives, strength, on a sense of meaning. Why? For empowerment, for growth, personal growth, psychological growth, occupational growth. So we want to be mindful that anytime we talk about balance between work resources and so organizational resources and those job resources, that we want to make sure that the work demand and the level of control that it is balanced. For any work resources that we provide, we want to make sure that they help towards not only to take care of the work demands, but then also they provide sense of growth and development for the worker as well. Then we have social recovery, the importance of seeking support when it's needed, but then also positive social support, positive relationship with supervisors. We do know continuously throughout research, positive relationship with supervisors is the single significant predominant factor for returning to work, for work functioning, and then also overall well-being in the workplace. And in fact, some of the key resources continuously being identified by the workers are ways to set work-life balance, managing the fatigue, feeling a sense of empowerment. So if there are any needs in terms of the workload, the work hours, how to be able to express it, and always positive supportive relationship with the supervisor. Then we have physical recovery, self-care, healthy lifestyle, and of course, functional recovery. Our roles, our responsibilities, am I able to manage the roles? Are the roles consistent here with my interests, my education, my training? In terms of here we do know, in terms of workplace and environmental, essentially, approaches, it's interesting when we also look at studies that have found that when people are faced even with high work demands that could be emotionally and physically demanding, and then also in terms of work-to-home interference, they do not always increase the risk for burnout when workers are provided with work autonomy, with constructive feedback, with, once again, social support, and especially positive, supportive relationship with supervisors. So again, we want to be able to identify and crystallize those protective factors at the human resource, human practice level as well. So anything that we are able to do within human resource practices, sometimes it could be job redesign interventions that could be helpful, task restructuring, any changes we can make in terms of the work demands, systemic innovative changes, the work hours, anything that could help towards enhancing the work-life balance, job training, job education, workload interventions, but then also here in terms of helping towards increasing workers' participation, workers' autonomy, the level of training, as well as here when we talk about empathy in the workplace. Empathy in the workplace, leadership training towards disability management, return to work, but then also empathy. Even starting with how to define what is empathy in the workplace, right? So of course, we know it starts with active listening skills, but that's again another set of training. What is active listening skills? Listening with our eyes, with our heart, withholding judgment, paying attention to signs of workload, showing compassion if anyone goes through any struggles or any stressors, and of course, paying attention to someone's visions and dreams. In terms of any interventions, individual interventions, so we do know right now in terms of any resiliency, we are aware of holistic approach. So yoga, mindfulness have been found to be helpful. Access to evidence-based treatment, evidence-based cognitive behavioral therapy, we know can provide a host of coping skills and social support, relaxation. But also we know through research, there are a variety of other approaches that have been found to have predictive validity in terms of work resources, work engagement, and financial return. So what are they? Well, we know coping flexibility, learning what coping flexibility is, which is not always approach coping or avoidant coping, emotion coping, or problem-solving coping. It's really knowing how to use our coping skills flexibly to better adjust to whatever situations. Emotional intelligence. We do know the better able we are to recognize our own emotions, including our fatigue level. The more we also tune to others' emotions, then what happens? We are better able to problem solve, seek support, seek resources, optimize our strength. And so what happens is that then we're actually better able to maximize our job resources and in turn better cope with the work demands, and the stress related to job strain also goes down as well. Job crafting, proactive resilience, proactive personality, they're all part of adaptive coping. So it's really, again, once again, what adjustments can I make? What resources can I seek? Consulting, seeking support, that I can make changes to my environment so then I can boost my productivity, I can boost my performance. If I have any struggles, I better know what to do, how to do it. Once again, also burnout goes down. So here, these are just some examples of how, once again, we want to have a better idea of this system approach, holistic approach to our care, and always combining individual as well as the worker level approaches. Thank you again, as always, for having me.
Thank you. Wow, that was incredible. Thank you, Dr. Kamkar. I mean, should we just move on to the next panelist?
Yeah, so I think let's go to Dave and then Kathleen, because I think Dave might have to leave a little bit earlier. So.
Okay, so we'll go to Dave. Welcome, Dave Libby, Commander, County of Renfrew Paramedic Services. Thank you for joining us, Dave.
Thank you. It's nice to be here. I appreciate the opportunity to be here. So, Ron, if you want me just to jump into the questions there, I can go ahead and do that.
Yeah, just jump in no particular order either. Just yeah, these are the types of things that I thought our folks would be interested in learning about.
Yeah, so for sure. Obviously, there are challenges that paramedic services in Ontario and really across the country are facing in addressing OSI. I think when you look at it, one of the things was the lack of standardization, the lack of a consistent approach, an educated approach on how to deal with these things. I know here we looked at, when the presumptive legislation that came down specific to PTSD, we started to understand that mental health is a much broader subject than just PTSD. So how do we start to look at those sorts of things? And I think for a lot of us, we were sort of operating in a void. In Ontario, we deal with WSIB, and I think all of us were sort of scratching our heads, saying, how do we now, in light of this legislation and all of the awareness around mental health, how do we start to make good decisions to support staff and to navigate our way through this? It's almost like the analogy of changing a tire on a car as you're actually driving down the road. So how do we sort of do that and make these changes and modifications? You throw a pandemic into it where really that was from a paramedic service standpoint, really, this was a time that we needed to really ramp up. We really sort of had to step out and help others and inject ourselves into the community in ways that we hadn't before, which caused increased stress for workers, increased workload, the fatigue, the extra activities that were going on, whether it be through vaccinations or testing or whatever the case is. So a lot of different challenges were there. We're looking at, we're dealing with a multi-generational workforce that have a variety of different ways that they look at work and work-related activities. I think, broadly, there was a lack of education on a lot of, whether from staff, labor leaders, managers, our supports through occupational health or HR. So I think a lot of challenges for paramedic services, but when you look at the new standard and how it can help organizations better, I think it helps give us that framework. It helps give us that standardized approach. In the development of the standard, there was multiple inputs, a very diverse approach to build the standard through, organizations and leaders from the labor side and from, the management side of things. We had health supports, occupational health, mental health specialists in there to build it. And I think, it helps to provide us a framework. So as we sort of go into this uncharted territory, we now have a bit of a roadmap that we can navigate through. And as far as other resources that are needed, we have not arrived by any way, shape, or form. There's still a lot of work that needs to be done. I think, speaking from, my organization, I think we need some practical help in implementing these things and moving these things forward. I get a sense that in this post-pandemic, or maybe it's too soon to say post-pandemic, but at this point, I get the sense that many organizations are just sort of treading water. And we see that across the healthcare system as, staffing shortages and these different stressors that came to light. I think we have to work on having better access to mental health resources, whether you're in a small rural community or in a major city. These mental health supports need to be recognized, not just everybody, hanging a shingle in a window, sort of to speak, to say that I'm a mental health specialist. I think we have to network better, those that have, mutual interests and needs to help support each other better. And I do think, we do need some funding to help support this and to move this forward. Federally, provincially, to put some of those education pieces in place. And then ultimately, I think it's about having a toolkit available for services, whether it be processes for them to follow based on the standard that's there, what sort of metrics we need to measure, key performance indicators to measure and sort of monitor growth and progress through that, and then again, access to resources. So to me, it's a work in progress. This is an incredible, great first step to develop this standard so that we all sort of, like I said, have that path ahead of us that we can follow and support our staff better through these challenges.
Thank you, Dave. That's very appreciated. We'll move next, our next panelist. Welcome Kathleen Frazier, Executive Director, EMS Employee Programs with Alberta Health Services. Welcome, Kathleen.
Thanks, Ron, and thanks very much for inviting me to speak today. I know that we're running close on time, so I will try and keep my comments short, but I did want to say that I did look at these questions through the lens of paramedic leadership, because that is my role within Alberta Health Services as part of the EMS senior leadership team, and how we have come to wrap our heads around the COVID-19 pandemic and what it means for our employees in terms of OSI. Certainly, we are seeing a larger number of OSIs than we probably have ever, at least in terms of those that we've been recording. And we face that sort of consistent leadership challenge of how to address these OSIs appropriately and also consistently, our system being provincial and encompassing a large geographical area and a bunch of employees and leaders all trying to do things in a consistent way. We also see in Alberta 30% increase in our system pressures, calls for service. And so that environment, of course, creates increased work demands, and those can result in more injuries, which then result in even more increased work demands for the staff that are still at work. So looking at that complexity, as well as the impact of COVID-19, not only on our frontline healthcare workers, but I think on the the public at large, and what that does to the work environment for our paramedics when they go out into the public and folks have been impacted in different ways in their own mental health. You can see things like increase in violence that our paramedics face, and maybe also increase in mental health challenges being experienced by the patients that they are being called to serve and care for. So there's all of that complexity. And I think just to speak to what some of my colleagues have said, we then we work hard to try and prevent injury. And when we're unable to do that, we need to also, as leaders, look at things like how do we create meaningful modified work for those that have work restrictions? How do we clearly outline the roles of all of the folks involved in our disability management system, be that our frontline leaders, managers, and supervisors, or how we work with WCB, our treatment providers, our frontline paramedics, and the union. It's understanding what everyone's role is within that system so that we can work together to the benefit of our paramedics. And so in terms of the standard, I think it really does help create that foundational document that Dave was referencing in his comments, helps us understand the resources that would be available, really helps to outline the best practice and evidence-based or research that exists around this topic, which can help organizations build a strategy, a unified strategy for how to deal with this work. And I think the final thing that I just would like to highlight is in terms of other resources needed, I see a real need for a community of practice moving forward with respect to this work. And that community of practice would be inclusive of all of the stakeholders that I've already mentioned, and really connect us to continued current research that is happening. For example, in Alberta right now, we have a research group called Highmark that is looking into the efficacy of reintegration for paramedics and other public safety personnel. And so really integrating that research as it becomes available, staying connected to our treatment providers who have that unique lens of what our paramedics are experiencing after injury, as well as connection to our frontline paramedics to get that lived experience reflected within the resources and supports we're designing to help them. So I think I'll just keep it at that, knowing that we're over time. But if anyone did have questions, I can stay for a few more minutes and try and answer them.
Oh, thank you very much. I'm just looking at here. Well, first of all, thank you for those wonderful discussions and advice, and that was incredible. I have one question here. To what extent the paramedics were involved in the process of implementation of the standard? And maybe I'll move that over to Amin or in terms of that question.
Yeah, sure. I think if I kind of got that correctly, I think the question is to what extent paramedics are involved or should be involved in the process of implementation. The standard sets requirements as worker participation throughout the process is a significant component of any management system standard. So the recommendation is that paramedics and those with lived experience are involved through all aspects of the implementation of this standard from the very beginning. And that also, one of the other good things about this standard is not only that is encouraged, but is required. And there is within the clause 4 of this standard, there's a requirements for roles and responsibilities in which worker participation, management participation throughout the process has been highlighted as a requirement.
Thank you, Amin. Another question is, how does workload and call numbers contribute to mental health outcomes? I'm not sure who wants to take that. Workload and call numbers contributing to mental health outcomes.
I'm happy to address that. I mean, obviously, we always need to engage in continuous research and data and so on because it can be very individualized. One of the most, again, popular work stress model is the work demand and job control model that continuously, again, is used throughout research and continues to be very helpful. And so we always want to make sure in terms of, again, work calls and so on, it's as long as it is also balanced, that the person is able to keep up, is being provided with the helpful resources and training, education, and so on to be able to keep up. But then also, once again, if we are thinking of the modifiable risk factors, if we are thinking of the personal resources as well, we just talked about, we want to make sure that the person is also able to cope with their fatigue, are still able to maintain their psychological well-being in the workplace. And then also with any workload and work hours, we are again helping to minimize any work to home interference, and also that we are able to boost this work-life balance. Again, in a context of we are able to maximize work autonomy, there is a positive relationship with the supervisor inside that workplace. See, all of those things can make a significant clinical difference.
Thank you very much. So, any other questions? No, I'll leave it over to you, Min.
Okay, thank you, Ron. Just to wrap it up, I think we've completed our third webinar out of the fourth webinar schedule through to this initiative. The final webinar will be on October 17 at 12 p.m. Eastern Time, hosted by Center for Research on Work Disability Policy. And the webinar focuses on how does this standard address the needs of paramedics with injuries and disabilities. And then we also be looking into developing a lot of resources. And as Catherine suggested, the community of practice, we're hoping to be able to kind of accomplish that within the scope of this project, and that would be hopefully managed and hosted by CSA. Before I kind of conclude, I just want to make sure that you're aware of our YouTube channel. We have all of the webinars recording in our YouTube channel, so they're available if you want to share with your colleagues as well. Pierre, any closing remarks?
No, thanks for the opportunity, Amin, and great discussion today. And you can see this is, of note just by the discussion is it's a cross Canada issue that we're all facing. And thank you to Kathleen, Kathy, and Dave.
Yeah, thank you so much. And thanks everyone for attending today's webinar. And I would like to also, on behalf of our team here at Cornerstone College, thank the panelists for their time and effort today.
Yeah, thank you.
Have a good one.